I hate to say it this way, how stupid are 15 and 16-year-olds when it comes to sex? If I was just going to ask it in a really crude way.
I wouldn't say stupid. I would say naive.
Okay.
Because at that time, let me back up. My experience, I've taught PE for years, both boys and girls. I've had years where I've had all boys. And some of the bravado out of 15-year-olds' mouths are just nothing, but it's laughable. You know, I've done this, I've done that. Baloney, you've done this and you've done that. It's all bravado, want to fit in, want to be the man, want to be the fool of the day or whatever it is. Don't realize how foolish they sound until a few years later.
Right.
And then they look back and, wow, they might really have hurt that girl's reputation or whatever. But you don't really see that at the time. You just want to fit in so badly. Do you see what I'm saying?
Yeah, I do.
So as far as being stupid, I don't think it's stupid. A lot of times I think it's naive. Sometimes I think it's people getting caught up,
yeah,
believing what they see, believing their friends, and when it's not all true.
Of course, it's not about being stupid. It's about having a better understanding. And that's what this program is all about, giving you a better understanding of STDs, or sexually transmitted diseases, sometimes called STIs, sexually transmitted infections. And I should tell you something about how we're going to approach this subject. We're not going to try to shock you or scare you or manipulate you in any way. We're going to talk about STDs straightforward. When I say we, I'm also including Betty. Frankly, she's amazing. She has been involved in teaching and educating teenagers on this topic for years. She's real, she's honest, and she has nothing but passion for her students and their understanding.
This is just a personal story, but a young man that I worked with last year, actually a couple of years ago, was just mortified that he had had a one-night stand with a girl, and the girl had started to cry.
We're going to talk about STDs one by one, starting with herpes. Herpes is a sexually transmitted disease that manifests itself in two forms: cold sores and genital herpes. There are two types of the virus: HSV-1, which mostly affects the mouth area, and HSV-2, often referred to as genital herpes. Painful lesions on the genitals, anus, and surrounding area may occur in both men and women may experience cervical blisters. Discharge from the penis or irregular vaginal discharge may also indicate the presence of herpes. Painful cold sores around the mouth, red swollen gums, flu-like symptoms, and painful urination are all herpes symptoms. Herpes can be transmitted through vaginal, anal, and oral sex, and mothers can pass the disease to their babies during birth.
Not only are you educated in them, but you've been around kids who've had to deal with them.
Right.
So as much as we can run through them, and help me if I leave anything out, herpes.
Doesn't go away. The first outbreak is extremely painful. The latter outbreaks depends on if they're painful or not. A tremendous amount of shame and angst that goes with the next sex partner. How do I explain this to them? Do I explain that I was with somebody else? How do I explain to somebody that I have an illness that's not going to ever go away? That's a tough thing for a 15, 16-year-old to deal with.
How common is herpes?
Very.
A lot of teenagers have it.
Yes.
Who are sexually active.
Oh yeah.
And do they have any idea what they're getting themselves into?
They do after that first outbreak, because it's so painful. So painful. Your lymph nodes get so inflamed that sometimes it's difficult to walk. Sometimes it's difficult to get out of bed. Yeah, it's extremely painful. And all the medications help, but at that first outbreak, you don't know what you had. You think you're dying. It's It's intense.
Hard to catch or easy to catch?